When Dr. Pond approached me and asked if we could be a part of this trip to Guatemala, I was very honored. Faith and Practice has been going down there and doing medical and surgical trips for the past several years, and as he put it was life-changing.
I wanted to go on the trip because it sounded like a wonderful opportunity to give back to people who wouldn't otherwise have access to it. I have a passion for serving people, and that's what drew me to physical therapy in the first place, and this is a wonderful chance to use the skills and the knowledge I have to serve people who need it.
We went to Antigua, Guatemala, which is a city that has like a big hospital in it, so the patients that we were working on came from all over the country to this hospital, and we went there to do as many surgeries as possible and reach as many patients as possible in only 1 week.
We did the physical therapy on the people right after the surgeries, and we were able to provide them education on what to do in the future because they don't have access to physical therapy there.
I had a patient that I remember very well. She wanted to be able to go to the market and walk around town. Those were some of her favorite things, and she hadn't been able to. But now that she had had her surgery, we were walking up and down the hallways, and she was so thankful and so happy that this was the furthest she'd been able to walk in a very long time. And I even remember her daughter was with us, and she was following us around, and she was saying something under her breath as we were walking down the hallways, and I realized that she was praying over us as we were walking, and she was just so thankful and so grateful that her mom had her mobility and her independence back, even just a day or two after the surgery.
One of my favorite stories was a patient I had that was a lady who had needed a hip replacement for a very long time. And the very first time I got her up to walk, we walked down the hall, and every step that she took, she kept repeating, "Oh my goodness, my hip doesn't hurt. I can't believe it doesn't hurt. I just had surgery." And she went up the stairs and back down, and she was just so excited and elated that she was going to be able to get up to her apartment where she lived.
I think I'm most proud of how we were able to take care of these patients even in less than ideal conditions and environments, and with the language barrier, still treating them with dignity and respect and giving them back their independence and their mobility so that they can take care of themselves and get back to the life that they had had previously.
I was so proud that we were able to accomplish the 67 surgeries that they did, even though I wasn't doing the surgeries. Just to be able to help that many people in such a short time was very rewarding.
I got to learn a lot and see a lot of different cases and see a more acute care based compared to outpatient here. And I really wanted to go and try and use my skill to help other people.
I think I was just most struck by how grateful and how hardworking all of the patients were that we worked with, and how they wanted to do anything and everything they could. They're just such a wonderful, kind, hardworking people, and I loved being able to work with them.
The relationships that we made with the group of people, just a group of mostly strangers coming together in a different country and doing our job together and working together as a team and getting along, was just an incredible feeling. Like, we just felt extremely bonded by the end of the week.
It's a great feeling to be able to give back to people.